Hi, good afternoon, everyone. The health talk will begin in another 5 minutes. Please wait for the rest to join. Hey, welcome to the virtual health talk. My name is Celine. I'm your host for today. Our topic for today is living with Parkinson's disease. So the insightful talk will be given by our nurse, Cui Xue and Sada. Okay, so if you have any question, can you save them for the end of the talk? Okay. Thank you.
Thank you, Celine. Hi, good afternoon, everyone. Welcome to our health talk. My name is Sada. Today's topic will be living with Parkinson's disease. I'll be presenting the first half of the presentation, followed by my colleague to share. Next. Okay, these are the content for today's presentation. Firstly, we will share on what is Parkinson's disease. Secondly, causes of Parkinson's disease. Next, the signs and symptoms of Parkinson's disease, the coping strategies, and lastly, we will share more on Parkinson's disease and mental health. Next. So what is Parkinson's disease? Parkinson's disease is a common neurological disorder that is thought to affect more than 4 million people worldwide. Parkinson is a slowly progressive disorder that is life-altering but not life-threatening. Recent advances in medication and surgery means that doctors and patients now have better control over the condition than ever before. Not everyone will experience exactly the same Parkinson's disease symptoms at the same time, and that the disease can affect everyone very differently, and in some cases, it may be many years before there is any disability or significant limitation of daily activities. Next. So what causes Parkinson's disease? In Parkinson's disease, certain nerve cells called neurons in the brain gradually break down or die. Many of the symptoms of Parkinson's disease are due to a loss of neurons that produce a chemical messenger in our brain called dopamine. So when these dopamine-producing neurons are lost, it leads to impairment of the muscle control, facial expressions, and also our bodily movement. So dopamine-producing neuron is very important for our body as they are responsible for keeping the body's movement smooth and well coordinated. Some people with Parkinson's disease does not have enough of the chemical dopamine because some of the nerve cells in their brain that make it have died. So without dopamine, people can find their movements become slower and it takes them longer to do things. Okay, next. So what triggers neurological damage in Parkinson's disease? Actually, the exact cause of neurological damage in Parkinson's disease is actually unknown, but several factors appear to play a role, including number one, genetic. Researchers have identified specific genetic changes that can cause Parkinson's disease, but these are uncommon except in rare cases. Next is exposure to certain toxins or environmental factors, but the risk is small. Ongoing exposure to herbicide and pesticide may slightly increase the risk of having Parkinson's disease. Lastly is heredity. Having a close relative with Parkinson's disease increases the chances that you will develop the disease. However, the risks are still small unless you have many relatives in your family with Parkinson's disease. Next. Then, and just to share, not everyone with Parkinson's disease has the same symptoms. You won't experience all of the possible symptoms and they won't happen in a particular order. So everyone with Parkinson's disease is different. So how a symptom affects you, the time the condition that takes to progress, and how it is treated may be different for you than for other people with the condition. Many people also find that how the condition affects them can change from day to day and even from hour to hour. So we have categorized the symptoms into motor versus non-motor. Motor symptoms are related to movement. Non-motor symptoms, on the other hand, are not directly related to symptoms. So what are the motor symptoms? Next. Okay, well, firstly is tremor. Tremor shaking usually start one side on one side lah. Parkinson's disease can cause some people's hands and bodies to shake. It usually begins in one hand or arm. If you have a tremor, you'll be able to notice it more easily when your affected body part is resting, or if you are feeling angry or excited. This is known as a resting tremor. Your tremor may decrease or stop altogether when the body part is used. This is the symptom that many people associate with Parkinson's disease, but not everyone with the condition has the tremor. Now, number two is rigidity, stiffness of the limbs, neck, and trunk. So rigid muscles can make it hard to do everyday things and can be very painful. You may have problems turning around, getting out of a chair, or making fine finger movements such as fastening buttons or touch typing. Some people find that their posture becomes stooped or their face becomes stiff, so it's harder to make facial expression. Next is akinesia, a loss or impairment in power or voluntary movement. So you may find that it gets harder to make movements and that they take longer. Example, some people arms stop swinging when they walk, their heel doesn't hit the ground smoothly, and they take smaller steps. These symptoms may be mild in the early stage of Parkinson's disease. Lastly is impaired posture and balance. Your posture may become stooped or you may fall or have balance problems as a result of Parkinson's disease. Okay, next. Okay, for non-motor symptoms on the other hand are not directly related to movements and can include issues such as loss of the sense of smell, which often occurs early in the disease progression. Like you might not be able to smell things as well as you used to. Next is sleep disturbances are also prevalent among individuals with Parkinson's disease, including difficulties falling asleep, maintaining sleep, and also experiencing restorative sleep, which can lead to daytime sleepiness and fatigue. Constipation is another common non-motor symptom, often arising due to disruptions in the autonomic nervous system. Depression and anxiety are also one of the symptoms. Some people experience these mood disorders during the course of the disease itself. Additionally, hallucinations characterized by seeing, hearing, or sensing things that aren't present can occur, especially in the later stage of Parkinson's disease. A drop in blood pressure upon standing, also known as postural hypotension, is another non-motor symptom that can lead to dizziness and fall. So in some cases, Parkinson's disease psychosis may develop marked by delusion and hallucination that significantly impact perception and behavior. So these diverse non-motor symptoms highlight how complex Parkinson's disease is. To properly help people dealing with it, we need to assess individually and address based on their needs. Okay, next. So if you're not sure if you have the symptoms, here are some tips. Examine your facial expression. Look for tremor in your face, your hands, your arms or legs, and examine whether there is stiffness in your arms, legs, torso, or shoulders. Determine whether you can get up easily from a chair, especially without using your arm. Another tip is examine your walking pattern and assess if there is any balance issue. And if you think you have the signs that we have discussed earlier, please do remember to seek medical attention. So what will happen when you decide to seek medical attention? How is Parkinson's disease diagnosed then? So the initial step of course often involves you presenting with early symptoms of Parkinson's disease itself. So during the first visit, you will be assessed for potential signs of the condition. A thorough medical history is then taken to understand your background, including any relevant medical conditions, medications, and family history. A complete physical assessment follows where you will be examined and checked for your neurological function, movement, and coordination. Diagnostic imaging such as the MRI scan may be also utilized to visualize your brain and to rule out other conditions that may mimic Parkinson's disease. Blood tests are also commonly conducted to check for any underlying factors or conditions that could contribute to the same symptom. And additionally, urine analysis may be performed to gather further information and to check for potential markers related to Parkinson's disease. Overall, this comprehensive diagnostic approach allows healthcare providers to carefully evaluate for Parkinson's disease, ensuring an accurate diagnosis and appropriate management plan tailored to individual needs. Okay, next. We would also like to share that a diagnosis of Parkinson's disease is life-changing. You will need long-term treatment to control the symptoms, and you may eventually have to adapt the way you do simple everyday tasks. So how do you cope with Parkinson's disease? Okay, next. Okay, so coping strategies. Firstly, take your medication. Secondly, exercise regularly. Thirdly, improve your sleep. Next is make time to relax. And lastly, balanced diet. So we will go in detail for each point. Okay, next. So number one, take your medication. Now remember about the cause of Parkinson's disease. It is due to the loss damage to the dopamine producing neuron. So the medication actually helps to increase the level of dopamine. So it's very important to take your medication. Never stop taking your medication without telling your doctor, and never suddenly stop the medication as it may have serious side effects such as unable to move or having difficulty breathing. Okay. So how does the medication work? Firstly, it increases the amount of dopamine in the brain. It acts as a dopamine substitute, stimulating the parts of the brain where dopamine works. It blocks the action of other factor enzyme that breaks down dopamine. The common Parkinson disease medication is levodopa. So nerve cells use levodopa to make dopamine to make up for the shortfall of the natural dopamine. Its effectiveness, however, diminishes as the disease advances. Okay, next. So when will you be prescribed the medication? Well, usually the doctor will advise you when you need to start the medication. You will be given specific times to take, which you should stick to the timing given. Okay. Next. Next is the importance of follow-up appointment. So when you are prescribed with medication, which medication you take depends on how much your symptoms affect you and other factors such as your age and your lifestyle. So most people find they find that they tolerate the treatment well and will return to clinic after about 6 to 8 weeks to review their response. So this is when your specialist or Parkinson's nurse will increase or decrease the dosage of your medication, the frequency, or even add new medication until your symptoms are as controlled as possible. So always remember not to skip your appointment. Okay, I will now hand over the presentation to my colleague Trisha, who will share more on the importance of exercise. Thank you.
Hello everyone, I'm Xie. So do you know exercise plays an important part of Parkinson's disease treatment? So how exercise benefits those with Parkinson's disease? While medication can help you to control the symptoms, like just now we explaining the first slide, right? Also, exercise plays a crucial role in improving flexibility, balance, and the strength. So for patients who exercise feels better physically and even mentally, and even can improve their quality of life. Because exercise can help to slow down the progression of the disease. According to the studies, the symptoms also appear to develop more slowly in people who were active before diagnosis of the Parkinson's disease. Patients who led a sedentary lifestyle tended to have complications faster. They were also likely to have more serious symptoms like stooping, tightness, weakness, and poor balance earlier than those who were more active. Next. So for the early stage of the disease, exercise helps to boost cardiovascular health, strength, flexibility, and balance. So at the early stage, right, patients with Parkinson's disease might already experience some tremors, slowness or movements, muscle stiffness, and joint pain. So doing a lot of exercises and even just brisk walking or raise up one's arms is important in getting patients to open up and fight gravity. So remember to start exercise now. Can try gym sessions like running, cycling, or even swimming will help. So three things we know about exercise for Parkinson's disease patient with mild symptoms is best to focus on the vigorous exercise that help you to work the whole body. So what are the vigorous exercise for us to start on, like jogging, running, but this one must be faster. So swimming, riding a bike faster, or like you ride on a hill. So playing single tennis, even play basketball, or just jumping ropes or carrying heavy loads will help also. For other regular exercises also can help improve your strength, balance, posture, and the flexibility. So to keep your heart and the lungs healthy. If you already started playing sports or even stay active, right, keep it up. So just to continue maintain at least to start exercise for at least 150 minutes per week will really help with your physical movement. Next. So for the Parkinson's disease, right, for the exercise, we always remember three components. So which exercise can help with our strength, balance, and the flexibility. So examples can be like yoga, like Tai Chi, like Pilates. So Parkinson's disease or some certain like Parkinson's disease, they have specific exercise classes for them. Also will help with the strength, balance, movement, and flexibility. Three things we know about exercise, the cases with the progressing symptoms like regular exercise will improve our strength, balance, posture, and flexibility. So it also can help with the sleep, tiredness, your mood, and even your mental health. So it's good to focus on the rewards of the exercise. Keeping up your body fit will help you carry on doing the things that matters to you, like our daily activities, like just showering, eating, or even wearing a clothes. These are the daily activities might be very difficult for the patients with the Parkinson's disease. Exercise that work the body and the mind at the same time also really good to manage Parkinson's disease. Sometimes we can just like choose a quiet place, quiet corner, listen to a light music, or even we just close our eyes, focus on our breathing technique. We can try to sometimes put our one hand on the chest, another hand on the abdomen, try to take a deep breathing. How to really know whether you have a right technique to have this deep breathing technique? It's like when you breathe, right, you close your eye. When you breathe in through your nose slowly, and breathe out through your mouth, but don't open your mouth big. And then just everything's do a slow. You feel not your chest like raise up and down. In order, actually is your instead is your tummy up and down. You feel your hand just like in and out. This is a right technique for deep breathing. So this one will help you in certain condition. You are not, when you stress, when you anxious, help you to calm down. Sometimes you will have some meditation therapy also will help. Even play Tai Chi or you are practicing yoga, even sometimes like dancing also will help. So for the complex symptoms of exercise, right, we focus on the everyday movements and the activities you have difficulty with. For example, if you have difficulty getting up from a chair, so you could start practicing getting up from a chair. Sometimes you might need some support from outside or even from other people's support, or other you need to holding on something before you can get up from a chair. So it's okay for you. You just need to keep practicing, will help you to solve the difficulty. So supported workouts can also help you stay safe and feel confident. Try chair-based exercise or exercise standing up while holding on something steady. Three things we know some exercise for PD cases, right? If they have complex symptoms, it's good to focus on everyday movements and activities. So like the right exercise will strengthen your muscles, increase mobility in your joints, and maintaining your general health and fitness. So it's never too late to start, to push yourself to do a little bit more from today so you can feel better. Next. The next coping strategy is to improve your sleep. So sleep and the nighttime problems are common in Parkinson's disease cases. They can affect you at any stage of the condition and may leave you feeling tired and drowsy. So as Parkinson's disease medication can cause excessive daytime sleepiness or sudden onset of sleep. This can be severe for some people, so it's important to get support from your healthcare provider if this happens. So you need to tell them whenever you face this issue. Excessive feelings of sleepiness during the day can also happen if you are not sleeping well at night. So this will cause some people dozing off during the normal waking up hours. Other sleep issues that can affect people with Parkinson, including sleep conditions like difficulty moving in the bed. So sometimes you want to make time, but it's difficult for them. That's why sometimes it will affect their sleep. So they always sleep at one side, right? Might be caused like body aching or even body numbness over the side. You may also experiencing mental health problem if you don't sleep well enough. So how to improve your sleep? Let's share with you some tips in the next slide. So the tip number one is a good sleep hygiene. So what's that? In our everyday life, right, habits and routines support normal sleep patterns. So keeping a regular hours and getting up at the same time every day will help to set our body clock, making you feel tired at roughly the same timing each night. So for bedtime routines help you get ready to fall asleep. Also, a familiar bed or bedroom, right, also will give us a comfortable sense of calm down and the security. That's why we can call this is a good sleep hygiene. When routines and habits are disturbed, so sleep is also will happen. If disturbed, sleep also will be disturbed, cannot get a well sleep, right? This often happens at least like a night or 2 nights. If you're going away on holidays, right? Maybe you change an environment that is not your own bed. So that's why you will be like unable to fall asleep. You might be ill. Surely this episode doesn't last long. So and the routine sleep pattern soon will return back to normal once you back from holiday or you come to your own house, sleep on your own bed, so you will feel better. If these are other things also can affect your sleep, like your habits and routines may also be disturbed. If this happen, right, you might be stop feeling tired at the bedtime. So your bedroom may not be feel like a place to calm down and you not feeling to fall asleep even you're lying on the bed. So this means that sometimes even if the original causes of your sleep problem is sorted out, right, but you can still have some other difficulties when you fall asleep. So remember to create an internal alarm clock that have a regulate time for sleep a week cycle. So tips number 2 is reducing time in bed a week. Sometimes you don't think you are longer time, spend more time on the bed is meaning you have a good sleep. It doesn't actually, it's no reason to stay just in the bed, right? If you are actually not fall asleep, just a week on the bed. So the longer time you spend, right, a week in the bed, sleep will become more broken and restless, and the insomnia symptoms can be carried on. So it may be tempting to stay in bed until you fall asleep, and it may help in the short term, but it's not effective in the long run. So actually the quality of sleep is more important also. Tips number 3 is leave time to unwind. So try to leave at least an hour to unwind before you go to bed. Try to do some like activities such as reading books, like watching television, or listen to a light music, or talking to someone if you have any concerns or worries to help you to relieve yourself, so you can have a better sleep. You can have a relief mind before you go to your bed. Sometimes if you feel like don't want to tell anyone, don't want to share your story, you also can write down you have any worries or concerns during this time period. So maybe you also can write down like plan how you're going to deal with them at a later date. So when you go to the bed, you won't think that too much. But sometimes you will think about the worries, right? Actually, it's not a problem. Right? Everybody will have some worry, but we just need to try to keep a positive mind before we go to bed. So the next coping strategy is having a balanced diet. So making some simple changes to the eating and the drinking habits also help us to manage the Parkinson's disease symptoms. So what is a balanced diet? Anyone can share like what is a balanced diet? So it's generally like following a healthy diet, like healthy plate, right? You must eat different kind of food, like eating the healthy portion of the food. Eating the right balance of the food groups also, like regular meals, like you must drink enough of fluids every day, especially like water. Eat some fruits and vegetables throughout the day. So for cases without diabetes, right, you can eat fruits but for cases with diabetes, right, you need to limit your food intake at the most 2 shares a day, 2 portions a day. So so what is the benefit related to having a balanced diet? Eating a balanced diet will help our health and may help to ease our many problems you might be experiencing, including constipation, low mood, reduce the bone density, and even the weight changes. So we will have one more question to ask you. How might Parkinson's disease affect our mental health? So we know the Parkinson's disease will help our physical movement, will affect our daily activities. So at the same time, also will affect our mental health. Well, you may experience a range of mental health issues alongside your physical Parkinson's symptoms. These are ranged from depression, anxiety, even to hallucination, memory problem, and dementia. Just now, actually earlier on, Sada got mentioned the part. Anxiety and depression are two of the most common mental health symptoms that affect people with Parkinson's disease. Also, nearly half of all people with Parkinson's disease have experienced one of these issues. It can be triggered by stress or receiving a diagnosis like Parkinson's disease, but they also can be triggered by physical changes in the brain caused by the condition itself. Sometimes even even when we want to talk, their voice maybe also change, like even the swallowing, even sometimes they like to write something, even they are able to hold the pen properly. All those kind of things, right, will trigger them to become more anxious and stressed. Okay, next. So remember, maintaining emotional health is essential to our physical health. So a person diagnosed with Parkinson's disease often feels a flood of emotions. Accepting and successfully navigating those feelings, whatever anger, sadness, grief, or even denial, is important. But everyone knows that it's very difficult to really to change your mind to really to accept or successfully to deal with all the difficulties, but we will to find some ways to help to deal with the stress, because the stress can make Parkinson's disease symptoms worse. So by focusing on your strengths, right, nurturing, caring relationship, you have a good relationship with your family, with your friend, then also you can share your concerns, your worries with them. Sometimes we will try to have a better healthy behaviors, and your spiritualities, you can better cope with the potential challenges you are facing. So we need to working through the feelings, because all the Parkinson's disease symptoms and the treatment can affect our mood. So depression and anxiety can, through some studies, you will see like up to 50% of the PD cases, they are actually having depression and anxiety. These mood changes can bring a worsening functioning. So in the end, that can decrease the quality of life. Tending to your emotional health keeps this cycle at bay. So tell your doctor who can recommend the right medical treatments, but also consider counseling. So for you and even your loved ones, if necessary, because the caregiver who take care of the Parkinson's disease cases, right, actually they are also like in stress. Sometimes if you don't want to like physically face-to-face tell people, you also can arrange, sometimes they have some support group, either online one got local one, even overseas, the support group for the Parkinson's disease. So you can join this kind of group, can share your concerns inside the group. Even the caregivers, they can get support from each other. Next. Number 2 is for embrace hope. So taking a deep look at the positive aspects of your life and nurturing them so that they can grow, help you to change your emotional outlooks. This positive relationships will help you, like you must like have a good relationship with your family, friends, or even you can have a new hobby. These are the things, right, will offer respect when things are difficult for you. So at the first, right, you must trust yourself to handle any challenges, because the Parkinson's disease cases, normally they will face a lot of physically and mentally distress. Reflecting on the past trial you might be have, whether can give you a confidence to deal with any future difficulties also. Number 3 is spiritually. So focusing on the deeper meaning of your life and embracing faith or moral-based core values can offer comfort. Spiritually means something different for everyone. So either you choose to pray or choose to have a meditation therapy or act or service, such as sometimes the Parkinson's disease cases, right? Even they have the physically difficulty, but they still go ahead for the volunteering to help with other people's. So even I have some residents, right? They really enjoy to like cook for other people, even they facing some like tremors. But through the volunteering, right, they feel very happy. They feel they still have the value. That's why this will help them to face their difficulties also. They will feel they have the value in the community. They still can help other people. So they have more like brief to face all the difficulties they are facing also. Okay, now we will go through some myths and the facts for the Parkinson's disease.
Yeah, maybe you guys can guess whether is it a myth or fact.
Yeah. So the first one, right? Only the elderly gets Parkinson's disease. Is it true or false? Only the elderly can get Parkinson's disease. Anyone? I will try.
False.
False. Yes, this is false. So we will tell you about the fact.
So the fact is that Parkinson's disease can affect adults at any age. So Parkinson is most common in people over 60 years old, but it can affect younger adults too. So 1 in 8 Parkinson's patients, right, is actually under 50 years old, and 1 in 20 Parkinson's patients are under 40 years old. Okay, next.
Is it all people with Parkinson's disease have a tremor?
No.
You are right. Okay, let's.
Okay, the fact is that Parkinson's disease affects people in different ways. About 70% of patients have tremor. Other symptoms include stiff arms and legs, slow movement, problems walking and balancing, and also changes in speech and writing.
There is no treatment for Parkinson's disease. Is it a terminal illness and a fatal? Is it no treatment for Parkinson's disease? Is it meaning someone have Parkinson's disease already? Is it meaning a terminal illness for the patient?
No.
You're right. Okay, let's go through the fact.
Okay, the fact is that there are effective treatments and people with Parkinson's can live for more than 20 years after a diagnosis. Though it's true that there is currently no cure for Parkinson's, and it does not get worse but it does not get worse, and it gets worse over time, but many live between 10 and 20 years after they are diagnosed. So the important thing is that medication, regular exercise, therapy, and in some cases, deep brain stimulation can also help to control the symptoms. Okay, please join for our next health talk. Thank you. Okay, if anyone has any questions, you can actually raise to us and we will try our best to answer them. Thank you.
Hello, Liz. Can you forward me the tip one? I cannot follow the tip one. Tip one.
Okay, hold on. So
Yeah,
sorry
the
for
tip one.
that.
That's a good
This
question.
one, yeah.
Yeah, this one, yes, correct. Thank you. Wait, I must take a screenshot for that. Everyone take screenshot. What is the meaning of tip one? Can you explain to me? Sleep-wake cycle.
So for this one, right, our good sleep hygiene, right, you must have a good sleep cycle. It's meaning, right, actually every night, right, we try to sleep at the same timing every night. Then actually the next day, then we can have around the same timing we wake up. It's meaning have a good sleep week cycle. It's not meaning, right, tonight I sleep at 8, then next day, right, I want to watch TV or I want to have a chit chat with my friend, then I sleep at 12 midnight or 11. So it's not say like if every day you keep changing, right, then you don't have a really good cycle. So your body, the clock cannot set up a really clock for your own self. Then because your clock will be, the alarm will be keep changing. If you every day sleep at the same timing, like night clock or even 10 p.m, right, if you every day sleep at this timing, actually your body will set alarm for your body already. So when tending to like 9 p.m. or 10 p.m, actually your body feel the tiredness, you will feel want to go to the bed, you want to have a sleep already. So this is a good cycle you need to set for yourself. It's like body, body is to have a clock in your body, will have alarm to your body. But this alarm actually is you have this habit to set this alarm for yourself.
Okay, thank you so much.
Welcome.
Hello, hi. Yeah, we noticed there's a question in the chat box. Is Parkinson disease linked to the dementia? Will getting one condition raise the chance of getting the other? So actually there's a difference between Parkinson's disease and dementia. So Parkinson is the symptoms might be about the same, but the condition is different. So Parkinson is because you have lack of the dopamine producing neuron. While dementia, there's other causes that it doesn't caused by the dopamine producing neuron. So Parkinson usually begins with the movement problems, but dementia is actually usually more on disease starts with memory loss and confusion. Yeah, so that's why it's important to take it's important for medical providers to actually ask for your history so they do history taking so that they can have a detailed assessment and then they can actually diagnose correctly. Okay, thank you.
How come, may I know how come the Parkinson person when they walk the time the leg becomes shaking Can I know about that?
So the importance of for us to move around and coordinated, right? We actually need this dopamine producing neuron. So when people with Parkinson have this lack of dopamine or producing neuron, so of course it will affect the movement as well. That's why you can see them have difficulty in walking.
Yeah, like that one Oh, difficult in walking
Balancing, walking, then you can see them a bit shuffle, yeah, and then smaller steps. So these are some of the signs that you can look out for. Thank you.
Thank you.
Hello. Hello. Can you hear me?
Hi, yes, we can hear you.
Yeah, from Sunlove, I want to ask is that is there any way to know from Parkinson whether you'll be later be a hand action or leg action, due to the symptom? Is there any way to know, or there's no way to know whether it's a hand shaking or a leg shaking?
Can you repeat the question again? We can't really hear.
Okay, the question is, as you know, there's a lot of symptoms, right? So it can be a hand shaking movement or leg shaking movement. So is there any way we'll know, or there's no way we'll know the symptom will be on the hand or on the leg or any part of the body?
Actually, for the Parkinson's disease cases, right, the tremors might be over different part of the body. So for the symptoms also will be different from case to cases. Some cases, right, they will slow in motion. It's meaning how when they move, right, they will everything slow down, or they will have the resting tremor. But for some of the cases, right, they are not slow in motion. They have this dyskinesia. It's meaning they cannot control their motion. They will keep moving. So you can see most of the Parkinson cases, right, they will have this slowness in movement. So when they sit down, right, actually they cannot control. Some is hands, some not hands or leg, some is like lower jaw, the mouth. They will keep clenching, the teeth will clenching to each other like this, like they cannot stop actually. That's why they will sometimes have the speaking issue, talking issue, like swallowing issue. But for some cases, like you will see their whole body or even their head, right? Actually, they doing some movement like this. They are able to control themselves, like restless. They cannot just like stand or even sitting at one place. They will keep moving. So cases by cases, so it's like they will have different symptoms like for Parkinson's disease.
Thank you very much.
Welcome.
Okay. Hi, I'm asking is that we mentioned that you must have a good sleep, right? But sometimes our clock keep waking us up at night to the loo. So will that affect anything?
You mean your own clock affect your sleep or no, or your body clock?
Body clock.
Body clock.
Your body clock So normally what is your body clock? It's like what time you going to sleep? You mean mid of the night will awake you lah?
Yeah.
It's asking a question only.
After what? Sorry. Oh, asking a question only lah. Okay. I thought after something. Also, you mean sometimes like for example, right? Maybe your body clock is because like why have the alarm right during the mid of night or early morning? Maybe sometimes you want to go to toilet, right? Pass urine. Sometimes they have the urine incontinence, right? So for this for these cases, right? They have a root cause lah. So we need to find the root cause to solve the problem. If your sleep right affected in between, disturbed in between because urine incontinence, or sometimes you have UTI, like urine infection, urinary tract infection. So you need to settle all this kind of issue to help you to have a good sleep and nothing to disturb your during the mid of the night. So this one also we need to know what are the issues, what are the problems to cause you have this body alarm to wake you early morning or mid of the night. Oh, this is a routine for you. This is a routine alarm. Every day will this timing to wake you up. Does this answer your question?
Yes. Thank you.
Welcome.
There's a question in the chat.
I think this question just now, my colleague Sada got answer, right? You mean the Parkinson's disease, is it linked to dementia, right? Actually, some studies they show about 80% Parkinson's disease cases, right? Eventually, right, they will have dementia, some issue with cognitive issue, right? Because their brain structure will have some changes in the end. But it's not all the dementia cases will have Parkinson's disease, because is you through the observation you also can know, right? It's not all the dementia cases they will have some physical difficulties, right? Like tremors, these are the specifically for Parkinson's disease, So Parkinson's disease might eventually get dementia, but it's not 100% Parkinson's cases will have dementia. Up to 80% eventually will have dementia.
Okay, may I ask you a question? How to protect our brain? Like is it reading do more reading, things like that. Social activity.
Yeah, so you must really have attend some social activity, like even so you don't every day just like stay at home lah. Then like just like watch TV or just play phone games. Just to go outside to join some activity, to have a conversation with other people will help you to maintain your mind to keep active. Sometimes even you play a game or card game with your friend also will help you, because as long as you keep your mind like to sing, then you will keep your mind more active. Or even sometimes, that's why sometimes for the dementia cases, right, they also let them at home, right, can play puzzle lah, or do some like drawing lah, also will help.
How about liver oil? Is it helpful?
What oil?
Liver oil.
Liver oil
Liver
Some, you mean the fish oil, is it, or liver oil?
Yes. Like Scotch. Cod liver oil.
Fish oil, right? Some fish oil they will say have the omega 3 lah, or omega or other omega 6 lah, or other things, right? They see this kind of like things will good for our brain lah to function. So for this thing, how we cannot see like you eat fish oil every day really to prevent you to getting dementia or have some other diseases, right? It's not really see how such kind of research showing can help you to prevent to get this disease lah. Maybe will help you to keep your mind like try to be more healthy lah. But cannot stop you if you have the chances to get certain kind of disease, right? It's not seeing like you take this one every day will help you to stop getting the disease.
Thank you very much.
Yeah. Fish oil so far don't really have any research showing fish oil will really help to stop you get dementia or like Parkinson's disease lah.
Okay.
Yeah.
Thanks.
Okay, we have another question from the chat box. So is having too much dopamine be bad for health long term? So for dopamine, right, so having too much or too little also is the issue lah. So if let's say having too much, then studies show that it's linked to some mental illness such as depression, schizophrenia, and psychosis lah. And then like too much dopamine is linked to being more aggressive and also have trouble controlling your impulses lah. So that's why we stress on the importance of follow-up appointment, where the doctor or the Parkinson's disease nurse specialist can actually check your symptoms and see how much dosage that you require and also frequency. Sometimes they will increase the frequency, sometimes they will decrease the frequency based on the symptoms that you are having. Yeah, hope it answers the question. Thank you.
Okay, thank you for our speakers for the valuable sharing. Okay, so now here are attendance for the feedback QR code. You can scan it. And we hope everyone found the talk is informative and take some key points to home with you. And thank you for your joining, and we will see you next time.
Thank you very much.
Okay, thank you.
Thank you for the talk.
Okay, thank you. Bye-bye.
Thank you, everyone.
Thank you. I wish you everyone with good health, happiness, and peace.
Same to you.
Yes.
You know, when they ask the fish